lecture will be on part 1 anatomy of the breast. If they give you breast cases, you should be able to get 4 marks because there's only a limited number of things that he can ask you. This is a schematic of the breast. This is a MLO view. So medial lateral oblique is the view you get in a standard mammogram. The other standard view is a CC craniocaudal view. In this, the most posterior muscle behind the breast is the pectoralis major muscle. Then you have the nipple and the areola. They're often called the nipple areola complex. If you can't tell what it's pointing to, if it's clearly pointing to the nipple, you can call it the nipple. If it's clearly pointing to the areola, then call it that. But if you can't tell, call it the nipple areola complex. The Cooper's ligaments are these thin structures within the breast, which they do like asking. And then you've got this, which is fibroglandular tissue. It's called glandular tissue on this, but actually I'd call it fibroglandular tissue because that is the correct breast terminology that they use in day-to-day vocabulary. This is a CC view of the breast. You know it's CC because you can't see the pec major shadow or muscle. The skin is the most superficial layer, as you can imagine. It's actually very important in mammograms because if it's thickened, it can suggest pathology, such as infection, but also inflammatory cancers. The fibroglandular tissue is surrounded by fat as well, which is this and that. Then you've got the nipple and areola, or the nipple areola complex. You've got, if they show you thin structures immediately posterior to the nipple, call them retroareolar ducts rather than Cowper's glands. That's what they're trying to point to, and those are the ducts that then link to the fibroglandular tissue. The pec major muscle isn't imaged on this, but it's behind the breast. And then you've got the Cooper's ligaments, which are these thin structures running through the breast. Cooper's ligaments and vessels, which we'll talk about shortly, look quite similar, but have a few distinguishing features. They do MRIs of the breast as well, and they look like this. This is the left breast, this is the right breast. It's an axial image, and it sort of looks like the snail's eyes on top of their antennae is what someone once described it as to me. And you can see the same structure. So you can see the nipple areola complex, where the nipple and areola should be. Immediately posterior to it are the ducts, the retroareolar ducts, or just ducts. Then you've got the fibroglandular tissue, the skin, the pec major. All these other things you don't need to know for the exam. And then Cooper's ligaments are the thin structures if they show you. So this is a CC craniocaudal breast mammogram, and they're pointing to this linear structure here, and this is a Cooper ligament or suspensory ligament of the breast. This is an MLO view, and this is pec major. B is the skin, C is the fibroglandular tissue, D is the nipple areola complex, or nipple is what they've said in the answers, but nipple is, I think if you say nipple areola complex or nipple, it should be fine. E is your inframammary fold, which is the fold between the breast and the chest wall. And these little calcifications, they're called rod-like calcifications in breast terminology, and this would be a vessel rather than a ligament because it's got calcification in it. These would be vessels as well because they look more serpiginous just than these thin little ligaments. There's some more examples. A, it's pointing to the areola rather than the nipple. This is the nipple, that's the areola. The thin things behind it would have to be the retroareolar ducts. D is the fibroglandular tissue. C is the Cooper ligaments or suspensory ligaments, you can say either or. And then E is a vessel. So you don't need to say what type of vessel, all you need to say is blood vessel or vessel. And you see how different it looks to the Cooper ligaments. And this one doesn't have any calcifications, but it's thicker and it looks more like a vessel, and it's more continuous than these things which actually start to fade out and you can't see the full length of them sometimes. This is an MLO view. A is your pectoralis major. B is your inframammary fold. C is a lymph node. There's a higher density structure here, and this is a lymph node. As you know, lymph nodes in the axilla are important when it comes to breast cancer, and you can see them on mammograms. D is your nipple or nipple areolar complex. E would be your retroareolar ducts, and then all this is your fibroglandular tissue. You've got a few Cooper's ligaments here, and these are the things that they can ask you, not much more. Again, A is a lymph node, that's what it looks like. This is a better picture. B, they're pointing at pec major. C is a Cooper ligament or suspensory ligament of the breast. D, nipple areolar complex, or nipple is what they said. E is the retroareolar ducts. Again, lymph node, pec major. C is a blood vessel because it's got calcifications, so remember that. And then D, they're pointing at the nipple. So maybe on this one I'd go for nipple. They've asked what's the tissue behind the nipple called. Just retroareolar tissue is what it's called. This is an MRI. And just to orientate you left and right breast. A is your pec major, the muscle immediately posterior to the breast. B is pec minor, the smaller muscle behind pec major. C is your fibroglandular tissue. This is what it looks like. It looks like it's got the same sort of shape as then on the mammogram. D is your sternum, and then E is a lymph node, so an axillary lymph node. So someone's axilla is here, someone's arm is down here, so this is an axillary lymph node here. A is your nipple, so right nipple, if you've got to give a side if you know the side. B are your right internal mammary or internal thoracic lymph vessels. You can call them internal thoracic or internal mammary vessels, maybe internal thoracic, and they just pass lateral to the sternum on both sides, and it's one of the branches of the subclavian vessels, the second branch. C is your pec major. D is your serratus anterior. That's that muscle that overlies the ribs, immediately overlies the ribs. Remember that. And then E is your suspensory or Cooper's ligaments. And that's the end of it. So that's the summary, and those are the main structures that you need to know.